It's widely known that a dose of Narcan can reverse the effects of an opioid overdose in a matter of minutes. First responders carry the drug with them on all calls, but Montgomery County is giving residents the opportunity to save a life as well.
So you're doing no harm by giving them a dose or two of the Narcan, and I'll show you how to use that.
The county is offering free training to community members so they can step in and help a person who is overdosing on opioids right away.
And certainly here in Montgomery County, we've had the full breadth and depth of the whole population, come to these trainings. So again, it would be definitely family members, it would be peers of users, it would be people in recovery now, it would be police, nurses, social workers, people working in the field. A lot of our employees in behavioral health and crisis services attend the session.
We know that if Narcan is administered in a timely way, it saves lives. And people make mistakes if the Narcan's not there.
If the first dose doesn't work for some reason, you have a second dose, just go to the other nostril.
It becomes a permanent mistake. If you can bring somebody back and you can get that person into counseling and get that person some help, maybe this is the time that a person realizes they have to make changes in their life. You won't get a second chance if you don't have that kit there.
That these come as 4 milligrams. Each of these is 4 milligrams.
Dr. Abby Morris is the medical director for the county's overdose response program. She says community members who are trained to administer the drug
Take it out. It looks like this.
Are key to reversing the trend of overdose deaths.
Fingers here. Okay, put your fingers here, on the bottom. So we have people who come from the shelters, people who come from libraries. Place it in the nose. I've been encouraging people to come from McDonald's and Starbucks because that's the bathrooms in which people are overdosing. And then you can withdraw that. So it's been exciting to see people get excited about what we're doing. I appreciate the county so much for wanting to do this. Again, as a physician, I've seen people dying in the ER. I've seen patients who've come after, serious overdoses, parents who've lost children. I have a private patient who lost her son to an overdose, and I see how that year after year after year still plays out in all of their lives. I mean, one life touches so many others. And so it is a good feeling to know that when people leave here, they're empowered to do something.
Since implementing the program in 2014, the county has trained more than 700 residents on how to administer Narcan, and the demand is growing. The classes can hold up to 30 and usually fill up. At the end of each class, there's a test. If you pass,
perfect. You did well in school, I can tell.
You leave the training with your own personal Narcan kit.
After you've given Narcan, they're in withdrawal. They don't feel so good. They probably don't want to eat. They may ask for some water, things like that.
Well, I just see how many lives it's affecting, especially mothers. I had seen some media about that earlier, so that really emotionally triggered me.
I've been aware of all the news reports recently about the opioid problems in this area and around the country. And because I'm a member of the Montgomery County CERT, I also had that interest. We, of course, are concerned with saving lives if necessary and assisting the public, definitely. And this would be just another facet.
We work with families with kids with mental illness, and so it could be a possibility that we might be at a family's home, and this could be something that would be valuable for us. I don't know much about it, so I guess I'm here to be educated also.
Dr. Morris says before someone administers Narcan, they should try and wake the person first.
And you're going to wake them up. Hey, Annie, hey, you, what's going on? You all right?
And of course, call 911 after administering the drug.
You don't know how far away the emergency response team is going to be. 30 to 90 minutes, this is going to wear off. So you might give Narcan, and if you've waited too long to call 911 and they're on their way and it takes them 45 minutes to an hour for some reason to get to you in this traffic, the Narcan could wear off and they could go back into being dead.
Currently in Maryland, you can purchase Narcan over the counter, but not all pharmacies carry the drug.
If I go to my local CVS,
Jacob Melamed is a clinical psychologist who recommends his patients who have a child with an opioid issue get training on using Narcan.
I see a number of parents who are bewildered about what to do when they discover their children are dependent on opioids. And my first recommendation is, as a Christmas gift, as a birthday gift, as an anniversary gift, as a gift to yourself, you want your child and you want to own Narcan because you want to be able to save your child's life, or your child should be in a situation to self-administer or have a friend administer. It's the best gift you can give someone who's struggling with opioid dependence.
To find out when the county will be holding its Narcan classes, visit the event calendar. In Rockville, I'm Susan Kenedy for County Report This Week.